Welcome back. Glad you could join us. Come take a look. See what counseling's really about. Check out all the cool stuff around the office. Notice the extensive use of technology. At Change Talk, we believe in an open, inviting space of emotional healing. The television that we have is used to show psychoeducational videos and background ambience associated with calming your fired-up limbic system. The sound machine we have in the corner of the room can do anything from the typical whoosh sounds to the latest pop hit that's #1 on the charts. Here, let me give you an example. It's a fire one too. Neat, huh? These plants in the room are a therapeutic tool that we'll discuss in later episodes, called forest bathing. Today, we are going to be speaking about the various different types of mental health professionals out there in the market. Like we discussed before, maybe there are a few of you out there who have already seen a therapist unsuccessfully, or believe that therapists will be just like the last one they had. Today, Change Talk is going to attempt to break through some of those myths and negative cognitions that prevent many people from taking the next step. It's equally important that today's discussion will paint a very broad and sometimes inaccurate brush when it comes to these professions, due to the many variances that occur in both individual professions and their locality. This narrative is more to highlight the fact that there are sometimes just as many similarities as there are differences in most of the mental health professions we will be discussing today. If you notice in my office, there are no couches, stereotypical tobacco receptacles. To be honest, I could show up every day in sneakers and be the better for it. Take a further look at the stuff in my office. Fun and interesting, right? If you can believe it, some professionals may believe that having so many items in an office can be a distraction, while I view them as momentary breaks of eye contact, talking pieces, and mood stabilizers. A lot of these pieces came from all over the world, and I even handmade a few of them myself. See? Not so scary, right? Another myth is that psychotherapists get paid a lot. See my desk table? It costs about $40 at a leading retailer. So that might give you an insight to how much money mental health professionals actually get paid. Yes, it's plastic. To get started, most of us know that psychologists and psychiatrists are some of the oldest mental health professions, but fail to understand the difference between the two. Do you know? Well, psychiatrists are medical doctors. They specialize in the mind. They can perform individual and group psychotherapy, but such practice is becoming scarcer and scarcer due to the real necessity for pharmacological and medical providers. They specialize in trying to figure out all the ways in which your body, diet, and various other physical aspects of your life are affecting your mental health. Just to name 2 conditions that generally raise red flags are thyroid conditions and things such as PKU. There is also a large correlation between your brain and your gut. And guess what? From getting hangry all the time to not eating enough, psychologists, well, these guys traditionally don't do medications. Despite that beginning to change in 3 locations in the United States, psychologists specialize generally in severe pathology and are awesome at conducting all sorts of tests in order to validate another clinician's diagnosis or to diagnose more severe conditions persons like myself are untrained in. Some hot topics that generally require a psychologist are personality disorders and autism. Psychologists generally view themselves as being the expert inside the therapy room. and frequently conduct individual therapy. They usually hold their PhD in clinical psychology and are considered doctors. Typically, nowadays, these are only a handful of master's programs for psychologists, since they can sometimes jump from their bachelor's to their PhD, depending on the program that they're in. Both psychologists and psychiatrists can usually commit a person for up to 72 hours to be evaluated in most states. Now, the less known differences between professional counselors, marriage and family therapists, and social workers. Licensed clinical social workers typically can do both individual and group psychotherapy, but they specialize in case management, which that really means it helps people find needed resources in overall for physical and psychological functioning. This can include anything from finding services, housing, professionals, or anything else that can affect a person's mental health. And guess what? They are really, really good at it. Social workers have also been around much longer than the following professionals we're about to discuss. Marriage and family therapists can do a little case management, but typically are really good at couples, family therapy, or issues surrounding social and relational contexts. They are a little more unique with the regard that they have a tendency of considering almost everything in your environment or socially, which might be affecting your mental health. This deviates a little from the traditional model of psychotherapy, or what we call the medical model. The medical model has been around a very, very, very long time, and one could argue that a sentence that encompasses what it would be the following catchphrase, right? Or chasing symptoms which may lead to future solutions. In essence, this mindset would be represented by X leads to Y, which will eventually lead to Z. Marriage and family therapists generally view things systematically. This means that there are a variety of potential causes or things that can exacerbate various types of pathology. And they typically explore all of these avenues at least once. Marriage and family therapists generally also considering themselves quasi-experts as well, often calling their clients patients in the process. Professional counselors, on the other hand, have a strong focus on both physical disabilities, mental health disabilities, and other issues surrounding overall development and wellness. We have a strong belief that the work that you do both defines who you are as a person and helps you find the purpose in your life that you have been looking for. Work propels people to help others and in turn helps them to help themselves. Not to mention, paying the bills is equally important and helps obtain the things we need in life in order to sustain mental health. Professional counselors also have a strong focus in individual and group psychotherapy, which some other types of professionals may not even dedicate a semester each intervention. Professional counselors are also great on helping you with your resume and various other needs towards reaching employment and various other aspects that have to do with work, and see themselves as a guide or even sometimes a student depending on your need. Now, with all these specialities listed, does this mean that a marriage and family therapist can't do case management? Or a professional counselor trying to conduct an assessment? Or social workers facilitating groups? Absolutely not. There is a great deal of overlap between professions, and it really depends on your professional's unique training and experience. Change Talk offers all of the above services and has a great outside network of medical providers and professionals, and for the more intensive types of treatment. Thanks for stopping by, and our next episode is going to cover the most popular types of psychotherapy on the market today and what you can expect during your first appointment. See you next time. Take care and Stay healthy.
Yeah, I love my job.